Hello, my name is Savannah Smith, and today I will be describing scapular dyskinesis type 2 through the SOAP process. Scapular dyskinesis is a common injury for those who play tennis. It is an alteration of a normal resting position of the scapula, and it often causes weakness and pain of the shoulder. To begin, my patient was a young adult female, exactly 25 years of age, and is an active tennis player. She reported pain and weakness in the right shoulder while performing racket swinging movements, and the symptoms started in the middle of the tennis season. She reports that pain is heightened during and after tennis practice and games, and she used home remedies such as hot/warm baths and over-the-counter pain medication. The remedies are good for temporary pain relief, but this patient will need a full treatment process. During observation, there was a slight deformity on the back near the right shoulder, which is called winging. It is a slightly prominent without movement, and it is along the medial border of the bone, which indicates type 2. The patient was observed doing winging, early elevation, rapid downward rotation, and shoulder shrugging during shoulder flex-on and abduction. When we performed the SAT and the SRT tests, the patient passed with little pain, which is really good. Weakness and sometimes pain was found in the rotator cuff muscles, glenoid labrum, heads of biceps, and the joint. I assessed that my patient was suffering from mild scapular dyskinesis type 2. I believe this because she had all the pain in the correct places on the body, the shoulder and stuff like that. I listed it as type 2 based on where the winging was. So this patient will need a treatment plan, and I am going to describe 4 of them. Using the bench, lie in a prone position and place the right arm hanging over the edge of the table. Lift your arm up and out and raise it above your head with your thumb pointing upwards. Do this for 30 to 60 seconds repeatedly. And here on the left I have some pictures describing. The second is using a rubber pulley, hold the end and repeatedly lift the right arm while standing. Do this for 30 to 60 seconds. And again, here are some pictures depicting what I'm describing. The third is using a rubber pulley, hold the end and repeatedly pull the arm back slowly for 30 to 60 seconds. The last is using rubber pulleys, put one side under your foot and hold the other end. On the second pulley, attach it to the wall and hold the other end. Reach your arm forward repeatedly for 30 to 60 seconds. Here are some pictures. To prevent further, the patient will need to perform these exercises at home and at a physical therapist appointment for 2 weeks to ensure that the injury can get better. The patient was also told to stretch thoroughly before practice and even more after practice. She also learned to understand her body's signals when the shoulder begins to hurt again. She also learned to give her body breaks and give her arm and shoulders relaxation. Thank you for watching. This has been a video on scapular dyskinesis and the SOAP process.